It has completely changed our practice in many ways. We were using CBCT before, which is time-consuming, contrast-consuming, and also not easy for every single patient. On top of that, the use of a CT allows us with very small amounts of contrast to check the position of the catheter, to make sure that we are in the right place at the right moment for a very low cost, both in terms of dose and also of contrast injection in fragile patients.
At the very beginning, honestly, I didn't know really how I could use it, and I was anticipating 20% of the capabilities of the system. But after weeks and months of use, some features of one system over and one system combined together were absolutely fantastic. We can do more and more multimodal procedure using C-arm, using CT, combining with ultrasound, because we have also an ultrasound system.
So the multimodality approach in our daily practice with children is that we can perform different procedure in one. Nowadays, we can, for example, do a bone biopsy for a tumor and insert a central venous line at the same procedure, same anesthesia.
We had a lot of patients that required both CT and fluoroscopy for safety. Now all of those patients can be done in one setting without movement, without relocating the patient, without resedating. So it has brought safety, it has brought efficiency, and it's also allowed us to do the cases that we otherwise couldn't do previously in a much quicker and safer way.
Having more technology in the same room is of paramount importance. You don't need to move the patient in other rooms. And of course, you may have total control of what you're doing. And if something wrong happens, you are in the right place for doing everything you can. Having all technologies make you more confident for doing what you're doing.
So we had the chance with the multimodality to increase the spectrum and the complexity of the procedure that we can offer to our patients, especially in the oncological field. And nowadays we can push the boundaries in this field to treat more complex tumors. I think we are increasing in the complexity of the procedure, bringing more solution to our patients.